this meeting is now being recorded as agreed previously early in the year. The recording will be placed on the website for public viewing. Yeah. I don't know if there's anything you want to say, Chair, before the start of the meeting.
I'm wondering if we should take a roll call, Willie.
Yeah, we're just about to take the roll call just now, if you're happy with that. So if anyone could answer present when I call their name. Councillor Lynn.
Present.
Trudy McClay.
Present.
Councillor Short.
I'm here.
Bailey Wright.
Present.
Anne Buchanan.
Present.
Donald McPherson.
Present.
Diane McCulloch.
Present.
Vicky Irons. Vicky Irons.
Present. Sorry, sticky buttons.
Dave Berry.
Present.
Wendy Reid.
Present.
Dr. Cotton. Dr. Cotton and Markham is absent. Raymond Marshall. Markham is absent. Jim McFarlane.
Present.
Eric Knox. Eric Knox. Markham is absent. Linda Gray.
Good morning, present.
Thank you. Martin Sloan. Okay, I've received apologies from Martin. He's attending a national meeting. Dr. Fletcher. Okay, we'll mark Dr. Fletcher as absent. Then have declarations of interest from any members of any declarations to the content of the agenda as it stands. There have been no declarations. You've got the minute of the previous meeting, which is submitted for approval.
Yep. Do this in the usual fashion. Just go through the pages, and if anything pops up, let us know. Page 1 of the minutes. Except I'm not looking at the minutes, am I? Yeah, I am. It's just there's so much more detailed. I didn't recognise them. Yeah, page 1. Page 2. Page 3.
Sorry, Chair, just a comment on page 2 at the very top, just being pedantic, my surname spelled wrongly.
Is it M small c, no A?
M small c, capital P, yep, that's me.
Okay.
Thank you.
Make sure it doesn't happen again. Page 3. Page 4. Page 5. Page 6. Page 7. And page 8. No, nothing else on that. Thank you. You can be agreed. Trudy's hands up.
Yeah, I just wanted to say, Chair, that the minute is impressive, and to thank Willie Waddle for the improved minute.
Yeah, much appreciated, Willie.
Yeah, thank you, Chair. We've got item 4 now. It's the membership and the notification that Councillor Anne Buchanan has now joined us as a member from NHS Tayside, in place of Jenny Alexander.
Yeah, I'd like to welcome Annie to the Dundee IJB and also congratulate you on your appointment to the Board of NHS Tayside. I wonder if, I know we had a wee informal chat before the meeting, maybe you could say a few words about your background, Annie, and what you hope to bring to Dundee.
Thank you, Ken. Yes, I'm delighted to be here. I'm a Dundonian. I trained as a nurse in Nine Wells. In fact, I moved to Nine Wells from DRI when I was a cadet auxiliary, and it was like the Starship Enterprise. So I lived and worked in Dundee, and then I moved to London in 1996. And I came back to Scotland as the board nurse director for NHS Fife in 2006, and Vicky and I worked together there. I took early retirement in 2013 and had a variety of jobs in the third sector, 3 years with Alzheimer's Scotland, work around advocacy, and latterly I worked in citizens' advice, helping people to raise their concerns about the NHS. So I suppose you could say gamekeeper turned poacher. I'm delighted to be a member of the Dundee IJB. I feel passionate about Dundee and all things Dundonian. My friends, my family are all still living in Tayside. So I'm looking forward to working with you all. Thank you.
Thank you very much. That's certainly a wealth of experience that you're bringing. So yeah, I'm sure we all look forward to working with you too.
Okay, thanks very much, Chair. That item being noted. Item 4B before you is a further membership appointment, the proxy member from NHS Tayside, and to note that Jenny Alexander's now been appointed to that position. For noting. Item 5 before you is Performance and Audit Committee, and you have the minute of the previous meeting of 26th of May before you for noting, together with his accompanying assurance report, which is also for noting.
Yeah, sorry, I'm just trying to find the agenda now, sorry. I've got it mixed up with the minutes. Yeah, sorry about that. Yeah, so item 5, yeah, reception. Oh yeah, the Performance and Audit Committee. Yeah, that's a really thorough report from Trudy, actually. I don't know if there's anything you want to add to it, if anyone's wanting to ask any questions. Trudy's hand's up and so is Vicky's.
I just wanted to say thank you for, again, an extensive minute, but also thank you to Dave Berry for his support in the Chair's assurance report. Very helpful.
Noted. Vicky?
Yeah, apologies for slightly late into question, Chair. It was just, I wondered if after this set of minutes I could come in with a very brief summary in terms of the current COVID response that we've had to mobilise over the last couple of weeks. Just
Is that, I'll just text, Tony, how tight are you for time? Have we got time for a brief update, or do you want to?
Oh no, absolutely, Chair. My next audit committee, the Angus IJB audit committee, is at 12, so there's plenty of time.
Okay.
It's just obviously if it's only at 1:45, you won't have the opportunity to ask too many questions.
Yeah, sure. So we have the update from Vicky, and we'll take you next then, Tony. Thanks for that. I see Donald's hands up though.
Thank you, Chair. I just had one question. Well, it's a matter arising, I guess, from the minutes of the Performance and Audit Committee, where on page 2 there's reference to an action tracker that would accompany the minutes, just to make sure that we don't lose sight of actions. And I was just would like an update on when we might see that.
Anyone like to answer that one? Dave and one other. Yeah, Dave.
Right. Thanks, Chair. Yeah. As you said, Donald, that was kind of noted at the last meeting, and Roger, Mary, and I had discussed that kind of prior to the meeting. So we should be in a position from the August IJB meeting to establish that action tracker and kind of share it with the board at that point in time.
Thank you. Is that all right with you, Donald?
Yeah, that's helpful. I'm keen to see it's possible, and I guess that should itself be recorded as an action to come to the August meeting.
Right, yeah.
Thank you.
So, Vicky, over to you, please.
thank you, Chair. I just lost connectivity there, so apologies if I've missed anything. And thank you for the opportunity to come in before we move on to the other agenda items for today. I felt it was probably just an appropriate time to update IJB members on the current response that we have enacted across the city in connection with current COVID levels by way of a general update. So members will be aware that the numbers in Dundee have been high in terms of the rate per 100,000 for a number of weeks now, and the highest in Scotland. We got early indications that we were starting to see a change in the number of outbreaks quite a number of weeks ago, and as a result of that, connected back in again with the command structure both within NHS Tayside and the local authority in terms of taking any further mitigating actions that we could as part of our resilience response. And I'm sure because there's been quite a lot of good communications around that particular coverage over social media that many will have seen, we have extended significantly parts of the city where you can have access to testing through our mobile testing units. And the details of that have been communicated quite widely in terms of where the unit will be at different days across the city. We've also done some targeted work with local authority colleagues to make sure that we have a kind of drop off of the lateral flow tests, particularly as many of the outbreaks in the early days were connected to school activity and school locations. So we've been active in making sure it's not an issue for people should they wish to take a test, whether they're symptomatic or not. So we've increased that. We've also done lots of work with the inclusivity group who work beneath the vaccination programme board to see what we can do to increase uptake across the city, particularly in certain neighbourhoods where uptake has been slightly lower. So there's been a combined effort across Tayside, not just within Dundee City, around reaching out to workplaces, reaching out to specific neighbourhoods, and latterly we've been joined by a vehicle from the Scottish.
I think Vicky's just frozen up there. I think you might have
ambulance, but that we can. Can you still hear me? Yeah.
Oh, yeah, it's breaking up an awful lot though. Maybe you might have to sign in and out again. I'm not sure if that'll help. Certainly can't hear anything now. Just give Vicky a minute, I think. Strange because the picture's really clear. Not breaking up at all, but you're just frozen. I don't know if you can hear me. Oh yeah, here we are.
Yeah, I've gone on my phone, but I take you can hear me on the computer now. There seems to be an issue with the laptop this morning.
Yep.
Yeah, okay. So as I say, we've increased availability of vaccination programmes to those who haven't yet taken up the offer of their first vaccine or due their second vaccine. And that's been opened up across different neighbourhoods, but also at Caird Hall as well in terms of a drop-in facility. We're also trying to do as much kind of public-facing communication and education as possible, not just to get people to take up the vaccine, but to really, really encourage people to still take precautions when they're circulating, when they're travelling, and when they're particularly when they're socialising. So essentially, I think we're deploying all the actions that we can to try and manage the outbreaks. But despite that, the numbers have remained high. So I don't think we're at the end of the number of outbreaks that we're going to see across the city presently. In terms of the impact across our services, without a shadow of a doubt, we're seeing huge pressure, particularly across primary care and GP practices and lots of community services. Not all of that is COVID related, and a lot of it is around remobilisation and people seeking health and support for various other conditions. And we knew that that would come, and so we've planned accordingly. And as far as our teams are concerned, the majority of them are essentially holding their own at the moment, but we need to be mindful that this is a workforce that are fatigued and are quite tired after a lengthy period of time working under emergency conditions. So we've got to make extra efforts to safeguard their health and well-being and being able to deal with the latest surge in demand that we're seeing. I'm sure that others will have seen quite a lot of national debate around how much of the COVID-related activity is converting into hospital activity. We have seen an increase in the number of people in hospital settings with COVID, but it's a level currently that's manageable. So those are issues which we're all keeping a very watchful eye on. So I don't know if there's any specific questions, Ken, but I thought it was just worthwhile having a general update today.
Well, I know that Trudy's hands up, and I think there's an awful lot of work being done to get the word out to people that it's important to get tested, because I've even had the pharmacy that I use send me 2 text messages saying that I can pick up a free lateral flow test, and I was down picking up something in our office last night and could see all the activity in the Caird Hall as well. So yeah, well done to everyone who's doing all that the good work. Trudy?
Yeah, I just wanted to say well done as well. And I know for our staff, there's also the worry about their children having to self-isolate. So the childcare is a big problem for a younger staff group that we do have that you do have in the community, Vicky, and sympathies with them as well, because it is a big worry. But to take up Ken's point on the lateral flow tests, I think it's very important to get the message out there, because you could be asymptomatic and pass the virus on to somebody else. So we need to really try and enforce that message, pick up a lateral flow test kit and do this twice a week. I think that's a hugely important thing for people.
Anyone else want to come in on what Vicky's just said? I don't see any other hands. So yeah, thanks for that, Vicky.
Okay, thanks.
Yeah, sorry, Will, carry on.
Okay, thanks very much, Chair. And my understanding is now we'd like to move on to item 12, which is the annual internal audit report. And it's a report by Dave Berry and also Tony Gaskin, who'll be speaking to the item.
Yes, great stuff. I'd like to go ahead.
Okay, I'll just do a kind of brief introduction. I'll pass on to Tony. So as it says, this is the annual internal audit report. So this is Tony and his team's kind of annual assessment of our governance activity, and as a reflection back over a year's worth of work, and also a bit of a kind of nod to the future as well, in terms of some of the kind of key risks and uncertainties that we need to kind of consider and address as part of the the IJB's arrangements. So I'll pass on to Tony because he'll go through it in a lot more detail. Thanks, Tony.
Thank you, Dave, and thank you, Chair. I think for those who haven't seen this report before, because obviously these often go to the audit committee, there are a couple of important things to say. This is our year-end report, which encapsulates the work we've done throughout the year, but also does other things. So working with Dave, we go through a checklist that looks at the entire range of governance arrangements within the IJB, from performance to the governance of the board and its committees, all the way through clinical and care governance, financial governance information. So it's the whole range of activity. And that is a different style of report than you may have seen in other bodies. And the reason for that is we want to give you as a board, and particularly the PAC, information which informs its view of the governance statement when we come to that point. So it's an important document in terms of that side, the assurance side, giving a holistic overview of the entirety of your governance arrangements. But it's not just that. The idea is to add value as well by focusing on certain areas that we think are really fundamentally important to the board, and by extension the IJB. So as a board, you have responsibility for certain things. Strategy would be one of absolutely the key ones. I see that you have a paper in item 8, which is about that topic. And that is a massive feature of this report because, as everyone knows, we've had an event which has overtaken all of our strategies, and I think that's well set out in item 8. And what we have done is we've spent quite a bit of time hopefully providing recommendations which will help the strategic planning group really focus on some of the key issues which we can see from item 8 anyway, but also some thoughts on how the board and the PAC might make sure that that's happening. Because I think, as Vicky has just said, we have a group of staff that have been working incredibly hard over a long period of time. And our message is not necessarily a nice one, which is to say, do you know what, when you get past all that stuff, we then have to look at strategy and make difficult choices and really do an enormously complex and difficult piece of work. And that has to be done at reasonable pace, because without that revision, we just won't be able to deal with different levels of activity, different ways of providing, and the pressures that were already in the system before we had COVID. So that's one important point. I would particularly want to draw your attention to paragraph 7. And it's very easy because we're auditors, we focus on the negatives. So we kind of tend to gloss past the positives, focus on the negatives. And
Tony, what do you mean by paragraph 7? Where?
Sorry, this is paragraph 7 of the audit report on page 3. The one that starts, the IJB has performed well in difficult circumstances. Okay. I'm not quite sure what page number it will be on your agenda. I've only got the separate agenda. I think Jericho Mail.
9.
Yeah,
9.
The last line.
Oh yeah, okay.
Yeah. So And that's not just something that we're saying, you know, some kind of, I'm afraid we don't really go in for pleasantries or just bland statements. This is genuinely our reflection on what has happened in the IJB. It has performed very well in difficult circumstances. There are long-standing structural governance issues which were created by the particular nature of the way that IJBs were formed and the difficulties that creates. And that means that a number of the things that you need to resolve can only be done in partnership with other bodies. They're not all within your control. And as we've discussed, COVID-19 has meant that the SCP doesn't, you know, reflect the environment now in which the IJB operates, and you'll have had loads of examples of that. So the important thing to say is, yes, there's a load of important recommendations. Some of them are quite highly graded. That does not mean in any way, shape or form that the IJB hasn't performed well. It's just a reflection of the fact that the risk environment out there, you know, we've had a tsunami, if you like, created by COVID, and this report and the recommendations within it reflect the fact that we've had to face an unprecedented situation. And although we've done it well, it leaves us, you know, in a situation where there's some really important things to be done. So we talk later on about, you know, the good work in the risk management strategy, the development of the improvement governance action plan, and we particularly welcome the Chief Officer's personal input into that to make sure things are being delivered. And, you know, a few of the other things that are still outstanding, which are recorded in your action plan and indeed in the draft governance statement. So there's a lot of detail there to provide you with assurance on a whole range of issues, and those are broadly structured in terms of corporate governance and other areas. And if I may, I'll just take you to the recommendations, which is the most important bit, because these are the things that you, as a board and through the PAC, will be wanting assurance that these things are being delivered. And the first two, not surprisingly, given what I've said, are about the strategic plan. So we're very pleased that that's been taken forward, and really recommendation one, the important piece here, there's a lot of thoughts around how you can align it with transformation, how other things might happen, but the important thing is that the delivery of that is monitored as a particular focus of the IJB, because it's the most important game in town moving forward. And we've got some thoughts about, you know, what we call the 5 Ps, how that might be done. And what's been agreed is that the strategic planning group will have a look at these recommendations, and indeed the next recommendation in item 2, and we'll report back on how they're going to deliver that. The next one about the standing orders, it's not the most exciting thing in the world, and fine, it'll get done when it gets done. And the other one is something we touched on last year, and there have been definite improvements in terms of dealing with some of these long-standing issues. And what we're saying there really is, you know, because we have the ability, you know, we also audit Angus, and we have an awareness of what's been happening in Perth IJB, and indeed in other IJBs across Scotland. A lot of the issues that we reported on last year that you have been facing for some time are exactly the same as the ones facing Angus, facing Perth, and indeed a load of other IJBs as well. So it's just saying, well, maybe it might make sense to cooperate, because rather than each organisation reinventing the wheel, there might be some benefit, particularly, you know, you've seen other papers that talk about the pressures on management. There might be some benefit in essentially divvying the work up and being more efficient that way, because you're broadly dealing with the same issues. And in a lot of cases, you want similar solutions anyway, because you're dealing with, all of you deal with one health board, and you'll have to link, you know, they don't want to be dealing with 3 different solutions. So it makes sense to try, you know, at least look at working together. And the final one, and I would say I'm very pleased to see that new risk management strategy, it's an excellent strategy, and we've actually shared it with other IJBs as a model of the way things could be done. And we're just saying, well, it's great. There's a lot of things that need to be done. So therefore, it'd be helpful to make sure that the PAC monitors those, because again, you know, we don't want to lose the good work that's been done, and therefore the PAC should be keeping an eye on it. So it's a wide-ranging report. I'm very happy to take any questions that members may have. And I would go back to, if you like, the initial message, which is that, yes, there's a lot of findings in there, but the overall message is the IJB has done exceptionally well in the circumstances. We don't want to lose sight of that. But as auditors, we're always going to focus on what needs to be done next. And that's why those recommendations are important.
Certainly welcome your overall findings. Tony, thanks for that presentation. No doubt the questioners I'm going to focus on some of the fine detail. Helen, I think your hand was up first.
Yeah, thank you, Ken. My question's on page 31 of the report. I don't know why, obviously with this new style of reporting, but on that page there's significant and moderate weaknesses in the design and the controls. Obviously it's concerning that there are 4 significant ones. What are these areas where we are weak, and really what we're talking about? And as I say, if in maybe future, if it's going to be this layout, you could perhaps put the page number, because it would be helpful to reference what the weaknesses are.
The weaknesses are those set out in the recommendations. So those directly linked to the recommendations 1 to 5 earlier. So that's where those come from. I mean, the layout's not new, it's just different from the way that you might have seen in other bodies, but it's the way that we've reported to some considerable time.
So the recommendations, what page are they on?
In your page numbers, starting at page 23, section 2.
Right. Okay,
And
thanks for that, because I had actually difficulty finding them, and I was really obviously, you know, I have concerns over the risk factors. So are these risk factors obviously very high, especially the 4?
Yeah, I think it goes back to what I was saying at the beginning, and then the analogy I always use is that of a flood barrier. Your internal controls are like a flood barrier, and if you have 8 foot high controls and the water only on average comes up to 5 foot, you're going to be pretty well covered.
Right.
And if you have global warming and the water levels start to rise, you're in difficulty. That doesn't mean the controls have got worse. It means that the environment's changed. And bluntly, if you have a tsunami, and I would view COVID as a tsunami, then you're going to be left in a situation where no matter how good your flood defences were, they're not going to cope with that thing. And that's where we are. So it's not necessarily, and it's difficult because we're using standard audit grades for a non-standard situation. We've had a tsunami. It's not that anyone did anything wrong. It's not that the design was poor. It's just that. And I think the reasons are set out quite well in item 8. We have had an event that has swept away. So you can normally have, and I've worked in the NHS for a long time and worked with IJBs for a long time now, and you can have 3-year plans, 5-year plans, and generally speaking, things don't change that much. And all of a sudden we had this thing that changed everything. And all it means is that we need to move in a different way and at a different pace, because the world outside has changed. It's not a weakness as such. It's just a fact that we're left kind of surveying the wreckage after the tsunami hit, looking around going, well, things need to change quite quickly. So weakness isn't a helpful word, I don't think. It's just saying this is what we're left with. These are and we're auditors, we think in terms of risk. What we're saying is there are some big risks, and the way to mitigate those risks is the delivery of a very different strategic commissioning plan at pace, accepting the fact that everyone is tired after dealing with the operational side, and it's a difficult thing to do because the landscape has changed so dramatically. And you can look at mental health as a good example of how population need will have changed quite drastically. And you can also see in item 8, there is a specific section that says, yeah, we're going to look at population need and how that's changed. So it's not to say that there's weaknesses as such, it's just that we are facing a big risk and we will need to have a strategic plan that mitigates that risk quite soon.
Yeah, well, thanks for that, Tony. But when I see weakness, I think something needs to get fixed and fast. But thanks for your answers.
Lynn, your hand was the first up, but it's been up and down that many times that I'm not sure if you still want to speak.
Well, it was perhaps just about the pace of change. I'm of the understanding that Dave and Tony worked on this together. Therefore, the pace of change and the indicative dates within it have been agreed. Presumably not just Tony and Dave, but also the wider corporate body that deals with how this is all going to get implemented. So, because some of them are fairly fast paced.
Yeah, to be clear, in terms of our report, the action is not to produce a strategic commissioning plan by August. It's to look at our report and build it into the way forward. So obviously the production of a strategic commissioning plan is going to take time, and you really have to think about engagement and how. So all that's been agreed is that they will take our report, they will take the bits in it, they will decide what's going to be done, how it's going to be done, and have a plan for a plan, if you like, by August. Not delivering the thing. Because we would all be worried if he said you could produce an SCP by all. I'd be A, impressed, and B, slightly nervous, because it's a massive undertaking, and one where you want to bring people with you, because there will be difficulties. And difficult choices to be made. So you need to bring people with you. So yeah, I think from memory, the paper you've got in item 8 talks around kind of a March timetable, which I think is sensible. But the August is just working out how we're going to do it and how much of what we've recommended can be woven into that process.
Yeah,
I think I'll bring. Oh, sorry, Lynn.
No, I was just going to say that the whole tsunami, as you called it, as the current situation, the teams have shown just how incredibly fleet of foot they can be, but now we're sort of 15 to 18 months down the line, so everybody has a tipping point, and it's very much pleasing for me to hear that is the case. Thank you so much. I do appreciate that, and I'm glad I asked. Thank you, Ken.
No problem. Dave's not next on my list, but I think maybe you'd want to come in relation to what Tony's just said.
Yeah, thanks, Ken. Yeah, just to kind of give the board the assurance that the August date is the next time the strategic planning advisory group meets, so it will be one of the substantive items on the agenda there. So just to kind of support what Tony said about August being the first time we'll have that discussion rather than having an end product.
Yeah, it's good to hear that we're on top of it and the process is moving along, and also that we're not expected to produce one by August. And the next on my list is Donald.
Thank you, Chair. I probably should just start by thanking Tony for the report. I mean, as always, it doesn't pull its punches, but it's a very realistic and balanced report, and gives credit where it's due. And I think it's really helpful for us to have an internal auditor who comes from that point of view. So welcome that, and also welcome the responses from management. Again, I think they're realistic, taking account of the situation that we find ourselves in, and we'll watch progress as they work to closure. My comment was really just around something that Tony mentioned. As it happens, I had the opportunity to sit in as a proxy member of another IJB recently, and while there are differences between us and the other IJBs, there are an awful lot of similarities as well in terms of the challenges we're facing, the issues we're having to deal with. And I did want to just focus in on the point in the report in paragraph 12 about this idea of taking a common approach to, I mean, you talk about intractable issues. I think when 3 people apply their minds to it, you've got a chance of a better solution than if one tries to do it on their own, or if three try to do it on their own. So I really welcome that. And I was just wondering whether there were any particular areas that you thought might be worth taking down the same approach as we did for the risk management strategy. But again, you know, thank you, Tony, for your work in this.
Thanks. I mean, the first thing to say is, you know, start with the positive. If you look at the risk management strategy, that is, again, that's been intractable in Tayside, it's been intractable across loads of IJBs. And the groups got together and under Dave's leadership, in fact, which I know it wasn't an easy process. And then sometimes having three different views can make it more challenging in terms of trying to integrate that. And I know some of the difficulties there, and I probably didn't help by providing 45 comments on the strategy, but you know, it did work in the end. It wasn't easy, but it worked, and it got something sorted that hadn't been sorted before. And if I just go back, I know if I go to the recommendation, fortunately the formatting seems to be going slightly awry, and we did have some thoughts. I mean, one of them is we know that there's been long-standing issues in terms of the support services, and we felt that was a key one. Was it here or Angus? Sorry, I'm trying to find the report now. So support services was one. I'm desperately trying to find the others now. Apologies. So there was certainly the hosted services is one that you're working on. But that is one that does need to be resolved, and you're working across that because obviously it matters. I think the support services was another, and I don't know, Dave, if you can remember that we did have three, I think, in a version of the report. I'm struggling to find it now.
I'm struggling myself, to be honest, Tony. There's what that other one was.
Oh, yeah, sorry. Yeah, it was corporate support arrangements, hosted services, and heaven forfend, large hospital set aside. Which and we did actually buried within the report, and it's probably an important point. There are, and there has been a number of discussions, and I had these in a lot of places. There is a national set of guidance for large hospitals set aside, which focuses quite strongly on some technical requirements. And there are good reasons from the IJB's perspective as to why certain aspects of that are important to make sure the IJBs, you know, are treated fairly. But there's also a sense in which, and it ties in with your strategic planning direction, focusing on strategic change that allows the health board to actually close things, which then allows money to free up, in our view, and that will require, again, that's why we mentioned it, the three IJBs to work together, because in a health board context, if one does something, the other two don't, it doesn't allow them to chart anything and free up resources. So there are important things about working together and maybe being a little more strategic. It doesn't mean ignoring the existing guidance because we don't have that ability, but it does mean putting your effort maybe into things that working together free up the resources and achieve the spirit of the recommendations, rather than being too obsessed with technical guidance, which hasn't actually delivered, you know, across Scotland, as Audit Scotland have pointed out. So again, that's a way of people getting together, jointly looking at these things, and maybe coming up with a solution that there's a win-win for everyone. And then some of these things are quite complicated, and in the case of large hospitals set aside, Dundee doing it in isolation just wouldn't help, because they're not going to be able to deliver the sorts of change that would actually move anything. So those are all examples, I think, and there's probably more actually underneath it. And some possibly even in strategic planning, there are elements where it might be sensible to join resources. If you're looking at population need, for example, there'll be certain changes that you could analyse across the piece quite helpfully, I would imagine. So those are the sorts of things we were thinking of. Sorry I didn't have it straight to hand, but it's been quite a busy old period, and I'm afraid I'm not as young as I was.
Thanks for that. Next up is Trudy, followed by Helen.
Thank you, Chair. Tony, it's a really interesting report and an easy to read report. I like the style of it. But I would like to make a comment. I'm not wanting to ask a question. I'm wanting to make a comment in that throughout this tsunami, we have had adapted board meetings. We've had briefings on a weekly and sometimes fortnightly basis. And I'd like to congratulate Vicky and Dave for the way they've managed service delivery, and also the population whose acceptance of our new ways of delivering services has been really interesting. And Lynn has spoken about, Councillor Short has spoken about the staff being fleet of foot. And I have recognised that both Vicky and Dave and all of the teams are now looking at new ways of working and taking what's been good in COVID. That seems an odd thing to say, but there have been things that have been good in COVID that can improve the service. And Vicky and Dave are very, very focused on these. So I'm looking forward to the August strategic commissioning plan update.
As you say, Trudy, every cloud has a silver lining. I wish we hadn't had this particular cloud, but yeah, that's thrown up some examples of good practice that we can use in the future. Helen?
Thank you, Chair. Yeah, it sounds like, well, we all know that the government's going to be making changes to the IJBs in the future. And I agree with working together on different things. I think that's always been the case. Or do I get from what you've just said, Tony, that we'll be going to a joint Tayside IJB in the future?
Oh, absolutely not, no. I have no, the government doesn't consult me on any of its thinking. No, this is just talking about pragmatic solutions, and it's building on success. The risk management work, and I know it was difficult for Dave because there was a lot of different views on risk management, but it worked. So I mean, let's be blunt about it. Audit's not a difficult thing to do. You look at stuff and you say, well, that worked, let's do more of that. That didn't work, let's change it. That's all we do. So it's nothing to do with any wider political implications. It's just saying, well, if it works, do more of it. And if it doesn't work, do less of it or change it. And that's all we're doing.
Okay, thanks for that, Tony.
I see no further hands. So the recommendations ask us to note the content and findings of the report and instruct the Chief Finance Officer to incorporate the recommendations of the annual internal audit report into our governance action plan. Is that agreed? Thank you.
Okay, thanks very much, Chair. That takes you back to the agenda as it stands. In item 6, there's the agenda note, preparation of the Integration Joint Board's annual performance report. I think that Catherine Sharp was speaking to the item.
Yeah, great stuff.
Thank you. I think that note is fairly self-explanatory. It's really just notifying the IJB members of the arrangements for the production and approval of this year's statutory annual performance report, and that approach is very much consistent with the approach that we've taken in previous years. In addition to what's there, I just wanted to reassure that the IJB that all members will have an opportunity to comment on the draft of the summary report prior to the publication at the end of July. At the moment, in terms of our timeline for that, we think we're likely to issue a draft for your feedback in the week beginning the 12th of July, so just so people are aware of the timescale around that. And we've also been in touch with those particular members and officers who are involved in the formal approval process at the end of the month to set out the arrangements for that and to confirm that people will be available. That's as much as I wanted to say, but happy to take any questions.
Oh, I just said that when I was on mute. What did I say? I said I don't see any hands. Thanks for that, Catherine. I think we can move on. Sorry.
Okay, thanks very much, Chair, for that item being noted and agreed. Item 7 then, before we use the leadership of public protection arrangements. And again, Catherine Sharp, I believe, will be speaking to that item.
Thanks, Willie. So we have traditionally from the Chief Officers Group in Dundee for Public Protection taken an update report to the Council Community Safety and Public Protection Committee, apologies, on a 6-monthly basis to update around multi-agency leadership work for public protection. And I think there's an increasing awareness that report should also come to the IJB for information, given the IJB's role in terms of the governance of a range of public protection matters, but particularly adult support and protection, drug and alcohol issues and violence against women. So in the future, we'd intend to submit these reports to the IJB at the same time that they progress through council structures as well. So apologies to some members who will have seen this previously in a council context. But it also follows on from the previous reports you've had over the last IJB meetings, the annual reports in the Public Protection Committees, and a briefing for all IJB and council elected members that took place a few weeks ago around public protection issues. And there was really great engagement from IJB members' attendance at that. So really, the team were really pleased around the attendance from IJB members. So thank you very much to everyone who took the time to attend. So within each report, we follow a consistent format. Normally in these reports, we have a bit of background around the Chief Officers Group arrangements. I don't think there's anything particular to highlight from that. People will be aware that Vicky, as the Chief Officer, represents the Health and Social Care Partnership on the Chief Officers Group, and Diana is also attending as the Chief Social Work Officer. We always set out data and trends. We always give an update on the Transforming Public Protection Programme, and then within the reports we tend to pick out another area of focus, and in this particular report that's been about the Wave 2 response to the pandemic. So I'll pull out a couple of key things around the Wave 2 response and the data, but I don't intend to go into a huge amount of detail because I'm aware you've had supporting reports and briefings recently as well. So in terms of the Wave 2 response, I think the main things to emphasise are that we really benefited in public protection from our learning and the measures, particularly around operational services that were put in place during Wave 1. So similar to the IJB more broadly and health and social care services more broadly, we were able to continue to apply some of the really positive adaptations to services and supports that had been instigated during the first wave, and to kind of further strengthen those through learning. But we did take some additional actions, and some of the key things we did were around investment in IT equipment to support staff who were providing frontline services to our highest risk individuals, and that included our adult support and protection teams within the Health and Social Care Partnership. And there were also a range of actions that further strengthened our response to substance use and domestic abuse in particular. And at the moment, there's quite a lot of ongoing attention around, I know Vicky mentioned at the start, about the impact of the pandemic on the workforce, and particularly in this area, given the levels of risk and complexity and need that people have been supporting during the last 18 months. So members of the Chief Officers Group are working, including Vicky, are working on a message of thanks across the multi-agency public protection workforce that we hope will be distributed in the next couple of weeks, just to recognise people's efforts around that. So section 4.4 covers the data. I think in terms of the IJB's areas of focus, some of the key issues are around the increasing numbers of reports of domestic abuse, and I'm sure people will have picked up from media reporting yesterday that the national police reporting figures were published over the course of this week, and that Dundee remains the highest local authority area in terms of prevalence in the population. So, confirmation that continues to be an ongoing challenge for the city. The other area in there is around the adult concern reports and high levels when we benchmark with other areas, but also the fact that we've been recognised that and have been doing a lot of work operationally to strengthen our approach to screening and to make sure that people who do not meet the statutory test for adult support and protection intervention get the right supports at the right time around other vulnerabilities that they might have. We've also really positively seen a decrease in non-fatal overdoses reported through the Scottish Ambulance Service and Police Scotland, and that reflects the really important work that's happened around the non-fatal overdose response team and having a more focused and rapid response around that. Last thing I was just going to focus on was the kind of forward-looking part of it at the end at 4.6. So the Chief Officers Group collective kind of focus for the next 6 months is clearly continuing around the pandemic response and recovery. So that will continue to be a significant focus at all of the the discussions around the Chief Officers Group and all of the support and activity. We are moving forward with a revision of our multi-agency strategic and governance structure, so looking at how we organise our committees and the working groups that support them, and trying to really have a focus on ensuring that is the best structure possible to use our resources to deliver on the strategic priorities around public protection. And that will include a range of leadership and service redesign programmes that will continue throughout the year. And finally, the Chief Officers Group have noted that they need to have some further conversations at an appropriate point in time about the impact of the independent review of adult social care in Scotland in relation to how that interacts with our strategic and operational arrangements for public protection. So similar to the conversations this group will have moving forward, the Chief Officers Group also want to look at that, particularly through a public protection lens, alongside some of the work around the implementation of the promise for care experience young people. That's as much as I wanted to say. I'm just going to invite Diane if she wanted to make any comment operationally from adult protection or adult alcohol and drugs perspective.
Yeah, thank you, Catherine. Yeah, I'll take the opportunity also as Chief Social Work Officer just to kind of do feedback. So I think first thing I would want to say is we really can't underestimate just how well our staff have worked to try to ensure that people remain safe. That was done against a backdrop of beginning not actually understanding or knowing how long we would be like out of offices, for example, how long we would need to kind of to socially distance. So people really had to completely rethink the way in which they engaged with the people that they work with to make sure that they were as safe as possible. And we've seen some really excellent integrated and joint working across both independent sectors and our own statutory services, and you know, supported by things. I mean, the Scottish Government, for example, in Children's Services actually put in a framework which defined what the minimum contacts were. That wasn't the same for adults, so it was very much about the staff kind of looking at their own professional skills and judgments and also their understanding of risk in order to take that forward. I mean, I think we've got a very full and detailed programme of work around protecting people. Sometimes it seems quite a massive programme of work around protecting people, and a lot of it is about changing culture as well as processes and approaches, and that can sometimes be a bit trickier to do. But people have worked again really hard to try to make sure that that has worked. And I think the other thing I would want to say is that I think over this last year, 2, maybe even 3 years, we're starting to see much more about how we bring all of those processes together and start to think about individuals, both from the point of birth right through to the point in which we're working with them, thinking about much more about family approaches and recognising that when we're looking at protection, it doesn't start with the incident that we're working with just now. Quite often it started much earlier in somebody's life in terms of why we get here. And I think we've seen that through a lot of our work in terms of our initial case reviews, our approaches, very much about starting to think about the whole life and everybody who's around them when thinking about matters of protection. And I think the report kind of highlights just how that is being brought together really quite well. So I don't think there's anything else we'd want to say. If I take the social work, Chief Social Work Officer hat and put the head of service hat on, then absolutely adults and protection is our area of work. A little bit background around the referrals. In Teesside, we've got a particular way of receiving referrals from the police, which means that we have a significantly high number of reported incidents. Quite often those are incidents which are about concern rather than about protection, but because of the way our systems work, we tend to record them all the way through. The thing we're absolutely looking at is how do we support people that come forward as a concern who do not meet the 3-point test, to make sure that we're confident that there are no gaps when people come forward, that because they don't meet a protection aspect, that we're not still responding to their needs. And the changes that we will make in terms of our recording and our processes will take both those things into account. Accurate recording, just protecting people matters, which will bring our numbers down, but actually ensuring that people get the support they need when they're coming forward as a concern. So a lot of work going on in test change at this particular point in time. Thank you.
Thanks both of you for speaking to that report. It's a very thorough report, which certainly gives me assurance that we're doing all we can, because in a city like Dundee, with the problems it has, you've mentioned drug and alcohol issues and the horrendous statistics. I think it was yesterday about domestic violence. It's really so important that we get this right. and I think it's a really thorough report. As I said, gives me confidence that we have robust leadership arrangements. I'm going to turn my usual methodology on its head in terms of who speaks next, because it's not Anne, but I'm going to bring Anne in first because it's her first meeting. So if you'd like to ask your question, Anne.
Thank you very much, Chair. It's a comment and then a suggestion. I attended the briefing on the 1st of June, and although it's subjects that are distressing, I felt quite uplifted that we're doing all this work to integrate services. I think it's the way forward, and I think I said at the time, to my mind, that was a lived example. This is a lived example of why IJBs and health and social care partnerships have come into being. So I'm delighted. The thing I was going to suggest, Chair, is in terms of trauma-informed leadership, I see that we're going to be doing some development work as an IJB. I think that would be a brilliant development for us on the IJB, so that we are trauma informed. If we are planning strategy and making decisions about people who have different lived experiences from us, I think it would be very useful. I, for one, would find it very beneficial. That's all I wanted to say. Thank you.
I completely agree. I see no reason why we can't arrange that at some point in the near future. Next up is Helen, please.
Okay, thank you. Thanks, Catherine, for that report, which is really very informative and gives the members of this board an interest in what's actually happening outside the IJB. I was very grateful for the briefings that we've had, because they were first class. But on page 20, and there's a graph on page 30, it's about the trends. And I think it might be interesting for the board to hear that the spike in homelessness figure has gone up. Given the ban on evictions, do officers know what's driving the increase in the spike?
Oh, sorry, Helen, I'm just finding the right chart in my papers. Just give me 1 second. Homelessness. Okay, so what I'll first of all say is that probably what I'll do is speak to Louise Butchart from Neighbourhood Services for a little bit more detail about the specifics of that. But I know the number of homeless applications obviously had risen at the end of lockdown period, so I think there's been that knock-on impact of people who've maybe delayed moving accommodation, or obviously a significant number of household homeless applications relate to relationship breakdowns of one form or another, so that had been delayed by lockdown periods, and then there had been a surge in demand following on from those times. So that's my understanding of the kind of key reason. It's kind of been a building up of demand in the system during lockdown and a release of that when restrictions have lifted. But I'll speak to Louise and see if they have anything in terms of their further analysis of the kind of factors sitting behind that they would be able to share, both with yourself but also obviously with the other IJB members as well, and can ask Willie to circulate that if that's okay.
Yeah, that's good. Thanks very much for that, Catherine. It'd be interesting to see, you know, officers' take on it, because it's not exactly straightforward. Thanks.
Up next is Trudy.
Catherine, a very informative report, and I did attend the public protection meeting, and I was very impressed with all the work that was going on. I do have a question on page 18 of our combined papers at 4.2.2. The work of the COG is supported by the appointment of independent chairs. I'm going to ask, why are the Suicide Prevention Partnership and Humanitarian Partnership excluded from this group?
Okay, Dan might want to make some comment on this as well, but I think that the appointment of independent chairs has been a bit of an evolution in Dundee. So we started with that only. Obviously, it's a statutory requirement in terms of adult protection and because that had been positive, it developed into child protection and then laterally to violence against women in the ADP. So Dundee's actually quite unusual in having an independent chair across all of those forums. It would be less common in other areas, particularly around the ADP and the violence against women partnerships. I think others have followed our lead and started to do that, including our partners across Tayside. So we are slightly unusual in having as much independent training capacity as we do at the moment. I think we haven't extended that to humanitarian protection and to suicide prevention. Humanitarian protection, I think, primarily because that group has quite a significant operational role, sitting alongside some strategic responsibilities, but it doesn't have the same balance. So all of the other committees with independent chairs are very much governance and strategic groups. That differs slightly for certainly for humanitarian protection and to some extent around suicide prevention. But I think Diane will maybe want to comment on the suicide prevention one, so I'll let her come in.
Yes, thank you, Catherine. No, Trudy, that's absolutely correct. We had a separate suicide prevention strategic planning group. We've actually just recently stood up again in order to review our strategy. One of the things that we felt was probably quite relevant is that separating it out from our general mental health strategy probably wasn't the wisest way to do things. So while we have an obligation to produce a strategy, our ways in which to do that are entirely up to us to determine as to how we manage it. So we're currently reviewing the suicide prevention strategy, and then our intention will be to monitor that through our mental health strategic planning group as part of a piece of the work that they will be doing. So it doesn't sit quite the same way as the other public protection groups sit in terms of the focus and the function of them, but it does have its own unique function. So we hope to bring the suicide prevention revised strategy to either the next IJB or the one after that. And as part of that, we'll make sure that we explain the governance arrangements around it.
Thank you, Diane, Catherine. Very assured by that answer to my question. And thanks, Chair.
Yeah, no problem. Can't find the agenda again. Lynn, yeah, your hand's up.
It's probably around trauma, and obviously there's a big sort of Scotland-wide emphasis on trauma, whether it was ACEs. Do we know whether there's any studies being done with regards to the trauma that everybody's going through now, and how that's going to impact how we move forward with the various services and things? Please.
So I think that kind of evidence and information is just starting to emerge. So there's quite, for example, in terms of trauma among the workforce in particular, we're aware of some large scale studies, academic studies looking at the impact on workforce and with focus of trauma and amongst that. So I think the detail of that, Lynn, is just starting to come out from a range of kind of academic bodies, some third sector organisations who clearly have an interest in that. And I think we're all just at the moment working on the fairly safe assumption, I think, that for people, particularly people who had trauma experiences in their life pre-pandemic, that this will have been a compounding factor for them, and for some people their experience of the pandemic will have been a traumatic one for them. So people experiencing trauma in a new or different way, and building that in, that assumption as a core understanding of what we do from here on. But I think some of that detailed evidence is still emerging from various sources, but we are keeping an eye on that. I know that you're aware. I know you've had conversations with Sophie Gwither, who kind of leads on that area for us. So we've got the trauma steering group, and Diane and I and others from health and social care are members of that, and that's the route through which we would be kind of collating and reflecting on some of that evidence as we move forward. And it may be in some of the future reports that around public protection that we could have a kind of focus around that trauma work to update the IJB members more fully about that.
That's fantastic, and it would be remiss of me if I didn't mention our older communities. Obviously, the effect of the pandemic has been incredible. From, in my area, the closure of Boomerang across the lockdown to the buses not running and things. That has an impact right across my community. So for the older people, if we can always just get it right for everyone, right up to the very, very top of the scale, as well as just, that's my plea anyway. Thank you.
I think that's a really important question you've raised there, and I noticed Vicky's hand's up too.
Yeah, it was just to build on Catherine's response to say and give an assurance that particularly the work we're targeting for staff, we're rolling out a programme of a piece of work which is about recovery and reflection, which is informed by, it's a trauma-informed approach. And I think we're very lucky to have quite a lot of expertise within the partnership, including Dr. Linda Graham, around building a response which is based on those principles, acknowledging that although we've had staff who have dealt with significant level of pressure and loss previously and prior to the pandemic, you know, these have been at levels that have been sustained over a significant period of time. We're also very well connected into the national groups which are looking at trauma, but also health and well-being moving forward and understanding the impact of the pandemic across the population. And I think there are signs in there that there are some very obvious groups where we're seeing a higher level of social anxiety. We're seeing that in younger people, and particularly those returning to school, and just people who've essentially gone through key life stages, whatever that may be, whether they're older or experiencing frailty, or in actual fact, whether they are younger and going through life transitions without having that kind of social interaction that you would normally expect, which gives you the right support to go through those changes. So I think it's incredibly important that we keep this discussion very live, but that we actually act very proactively here, and we ensure that there's the right support, the right resource available to people who are experiencing differences in the way that they respond, differences in anxiety, difference in the way that they would normally manage and cope with day-to-day issues. Because if we can get in there early enough and give people the right tools to help themselves, I think that will have a huge impact. And we have to also understand that for a lot of people, it's about acknowledging that these are very human responses to the circumstances that we've just been in. And particularly for our staff, it's about giving permission for them to talk about their experiences and to openly, regularly make those informal connections across the teams that don't necessarily form part of our daily working lives at the moment. So there's quite a concerted effort needed here, but I think it's just as well that we've acknowledged that today on the IJB.
Yeah, it's been such a messed up time for everyone. It really has. I spoke to my niece on the phone last night, and today is her final day at secondary school. You know, the last year at secondary school, it wasn't what it should have been at all. The poor wee soul's going to Edinburgh Uni now in September. I don't know what her first year is going to be like at uni. So that's like key life stages that have been messed up for so many people. So sad. But what can you do? On that gloomy note, I think we can move on, because that's just for noting. So yeah, that was a really enjoyed reading the report. Really enjoyed listening to your responses and the questions that were raised. So thanks for that.
Okay, thanks very much, Chair. With that item having been noted, item 8 then is Strategic and Commissioning Plan report, and Catherine Sharp is speaking to the item.
I promise this is the last one from me today. So it's probably actually the reordering of the agenda today has probably been quite fortunate, because I think that it makes sense to be talking about this report in light of the conversation earlier and input from Tony, particularly around the Strategic and Commissioning Plan. So I'll keep it brief in light of that, because I think some of the issues have already been given quite a good airing. So we're very conscious that in December we brought a report to the IJB and made some recommendations which were agreed at that point around the timescale and approach to the revision, the statutory review of the Strategic and Commissioning Plan, and any subsequent work that would be required to revise that. And clearly we made those recommendations based on the best information that was available at the time, but shortly after things changed again substantially. So we've had the second wave of the pandemic, and that the subsequent impact on our capacity to deliver against the existing plan, but also a clearer understanding about what response and recovery is going to look like over the next sort of 12 to 24 months as well. So this is really about coming back to the IJB to recognise those changes, that the strategic planning group are considering whether the recommendations that previously made to you in December are still the right ones in terms of a direction of travel, and to set out, and I think that's probably the most important part of the paper, at 4.6, the factors that they are actively considering in terms of coming back to the IJB in October to make some firm recommendations about the best approach, a sustainable and realistic approach to the review of the plan and the subsequent work. It's really useful to listen to Tony speak earlier and to look at the internal audit report. I think it gives us some really helpful guidance and direction, but I'm also very much reassured that it's broadly in line with the discussions the Strategic Planning Advisory Group has already had about how they think they might approach this task. So I don't think there'll be any difficulties or surprises for us when we meet in August with them again in terms of reviewing the report from internal audit and thinking about how we incorporate that in a set of proposals to bring to the IJB in October. I think that's as much as I would want to say in light of the earlier discussion around this as well, unless Dave wants to add anything.
No, nothing else for me. I think Catherine's covered that very eloquently, so thank you.
I noticed Raymond has his hand up.
Thanks, Ken. Chair, I'm not sure if this. I'm just opportune as far as when you mentioned commissioning, and I'm just conscious that the news of Dundee City being the way around the living wage around their commissioning, so ensuring that services meet the living wage requirement. I'm just curious as to how this would impact. I know that's more of the detail about the contract rather than the commission and strategic plan itself, but how we're going to ensure then that that's incorporated. You know that I've banged on this bell a few times, Dave, around they seem to come cap in hand later on and say, oh, by the way, where's my extra money to deliver the living wage? Whereas we should be ensuring that that living wage is imposed at the start of the contract rather than them coming as an addition. So if you can't provide the service with that living wage element, then should you be considered to deliver those services? So I know it's a bit rough, but I'm probably want some assurances that will happen, and it's a commitment to do that. Thanks.
Okay, thanks for that, Raymond. Yeah, in terms of the kind of living wage and actions, probably in a kind of more broader sense around kind of fair work within social care, that is quite a kind of national push around that. I've been involved in some of the sort of national discussions around that over the last few months, Raymond, which kind of led to, for the second year in a row, almost like a national kind of approach to implementing the living wage across social care providers. So when we agreed in our budget kind of process, and again we've got the next items kind of touches on that to a certain extent around implementation of the living wage. So we were kind of, as commissioners, were required to pay across the providers as quickly as possible additional funding to ensure that the living wage would be applied by those kind of care providers. As part of that process, there is a kind of written agreement. They have to kind of sign off that they will pay the kind of the living wage in that regard. But there is a kind of quite a lot of kind of work, as I say, being done nationally, and that will kind of fall in through the independent review of adult social care and kind of taking forward through some of the Scottish Government's kind of proposals over the coming years around ensuring that kind of fair work in social care is kind of completely embedded in the approach. And we already, in terms of our kind of our current sort of tender process, devote quite a bit of the kind of tender evaluation, if you like, into sort of the fair work agenda. So, you know, that's just in terms of that assurance, you know, that's something that we would expect from all of kind of any new kind of tenders that come through, that a fair work elements are included within staff terms and conditions there. So there's a lot of work being done to kind of make sure that's kind of embedded in the future.
Do you have something to add to that, Catherine?
Yeah, it was just to say, from a strategic planning point of view, members may be aware that the market facilitation strategy is a companion document to the strategic plan, and in terms of elements like fair work, but also a range of other issues that probably were raised through the independent review of adult social care around ethical procurement approaches, that's probably the place that we would capture some of our strategic commitments around that, which are obviously then underpinned by the operational parts that Dave's just referred to. So when we come back in October with an outline of how we're going to approach the strategic planning process, we would also intend to cover those companion documents, and that will include that one, Raymond.
Trudy is next.
Thank you, Raymond, for raising this fair work question. We were at a meeting yesterday where we discussed the care in the community and how the carers, some companies do not pay carers for the time that they travel between different clients. So they're only paid when they're in the person's home, and then they could be travelling maybe 20 minutes to the next home where they're not paid. We were actually talking about P&K and the fact that there could be a 3-hour during the day travel distance that people are not being paid. I'm sure that isn't the same in Dundee, but I think that should be considered as well. Are people fairly paid? Why should they use their own time to travel between different clients and not be paid for that part of their role?
It's a fair point you make there, Trudy, for sure. Oh, I took my eyes away from the screen and now everyone's hands up. Donald's next. And then maybe Jenny wants to add to that, though. I don't.
Yeah, so I was just going to say exactly the same point as Trudy, so I took my hand down.
Oh, okay.
But I was as surprised as I think Trudy was to understand that that was a practice. So yeah, I'd like some assurance around this as well.
Yeah, Jenny, would you like to come in, please?
It's just to provide that assurance that that would certainly be something when we're looking at commissioning in future would be part of our kind of fair work approach, would be to look at all these terms and conditions around workers.
Okay, that's reassuring. Jim.
Okay.
Thanks, Chair. I mean, it is just following on particularly the points that Raymond and Trudy made, that it is really important that, the fair work principles and the fair work agenda aren't an add-on, that they're thoroughly embedded into the whole process, and that we get away from these horror stories. And it's ridiculous that they're still happening. I mean, we've been firefighting them for a number of years. Trade unions, this idea, people not being paid for their travel time. Some of these companies charging staff for their uniforms and stuff like that. It's outrageous, and never mind the further debate around even just, I know I keep banging on about it, but what weighting we give to all those points is really important when we are giving out tenders and contracts for these types of things as well. It is. And then my further point, and I know, care jobs should be paid more than the living wage.
Absolutely. Totally agree. Trudy?
Yeah, I just want to come in on the back of what Jim had said about care jobs. And it is recognised that we're losing a lot of the care workers to the hospitality industry because they pay better, they get tips. I'm not expecting our care workers to get tips, but if we paid them a decent wage and we paid them for travel between clients, I think it would make the job more attractive. We need to make it attractive. But within that, I feel that care workers should have some sort of education, talent management programme where they can advance rather than always just be a care worker. So that's just another thing to think about.
Well, there's certainly stuff. We've been talking about the independent review of adult social care. There's certainly a lot of stuff in there about how much we value people who work in the care sector, and reflecting on how much they're recompensed for the work that they do. Now, because I'm on my iPad, it's been a wee bit hard here to work out whose hand was up, but I know Anne's was up, but it's gone down again. Do you still want to come in, Anne?
It was just exactly what you said, Ken, the review of adult social care. All of the points that have been raised were covered in Derek Feely's review, and it'll be fascinating to see where it goes. But if it goes the way it's intended or it's recommended, we will be doing the commissioning as an IJB, all of the commissioning. So that puts power to our elbow, and we can address the concerns that colleagues have raised. So that was all I wanted to say. Thanks.
Yep, no problem. And where are we now? Helen and then Donald, would that be right? Yeah.
Yeah, I just really want to remind people exactly what it's about. It's about vulnerable people who have our services. They deserve the best services that we can give them. And I think our social care officers are often their best friends and confidants. And these people who get the services are very grateful for the services, and often they're life-saving. And I think you're right, they deserve the best and they should be paid what they're due. Sorry, thank you.
Yep, thanks for that, Helen. Donald?
Yeah, I was really probably not adding an awful lot to what's already been said, but I think clearly the debate around this point has touched a nerve with quite a number of us. And I was grateful for Jenny's assurance that this is factored into the consideration, but I suspect others would like to understand probably a little bit more about exactly how it is factored in, and the significance of paying a living wage. And I'm not expecting Jenny to answer it on the hoof, but I wonder whether it's something that might be appropriate for a bit more of a deep dive at the next meeting of this board.
Yep, Jenny?
I'm not going to try and answer that on the hoof, but I'd be happy to bring something back if that was appropriate.
Yep, that'd be great. Thank you. And Lynn?
I was just going to bring to the table that amongst the many hats that I wear, one of them is fairness spokesperson for Dundee City Council, and we do have a campaign across the city called Making Dundee a Living Wage Place, which has already been incredible, not just the accreditation but the uplift that has happened with many people's wages. And there is a steering group, so perhaps it's something that maybe the IJB could, or Dave maybe wants to speak to some of the people on the steering group, because they come from public, private, academia, so they're across the spread. They're not just necessarily within the council body. So and I know that they have discussed with a very major Dundee-based care company previously about becoming accredited. So if there's almost like a pincher movement, it might be a good opportunity as well. So I just thought I'd throw that in there for everyone.
That's been a good debate. I think that the debate we've just had has branched out quite a bit from the report, but it's really good to know that we're all singing from the same hymn sheet, and that our new member is singing from the same hymn sheet too. So onwards and upwards. Raymond? That was my closing remark, but his hands are still up.
Apologies, Ken. I was just like to thank the board. Obviously, it did stir people up a wee bit, but and I welcome everybody's support around this. And I've suggested in the chat to for Jim and myself to speak to Jenny and get a better understanding about how this applies, and hopefully that will maybe form part of the report that Jenny will bring back. But clearly, we need to work towards having, and I agree with Lynn, this is about fair work. It's about a living wage city, and happy to support that from, I'm sure Jim will say as well, from a trade union perspective, to support that for the people within Dundee. Thanks.
Yeah, no, don't need to apologise for standing not there at all, anytime. That's what we're here for. I think that's the conclusion of this item. We're asked to note the contents and also the usual bit about instructing the Chief Officer to make detailed recommendations no later than the 27th of October of this year. So, thank you.
Yeah, thanks very much, Chair. Item 9 then is the agenda note on the Integration Joint Board budget. Dave Berry will be speaking to the item.
Okay, thanks for that, Willie. Yeah, so just taking a short short agenda note, just providing an update on the budget position. As members will recall, when we agreed the budget back in March, the NHS Tayside figure was still a provisional figure because the board hadn't met to confirm its annual financial plan, operational plan and financial plan, and we've now had formal notification that they met at the end of April, and that the figures that were given to us previously are still the figures for Dundee. There is still some work to do, as was kind of alluded to in the earlier around the large hospital set aside, so we don't have that one yet, but that's probably kind of less of a concern at this stage anyway. The other element which was gave us a bit of uncertainty at the last at the budget meeting, if you recall, was we had just been told that there was going to be further funding coming in around living wage, so just kind of what we were speaking about a few minutes ago. And at that point, we didn't know exactly how much was going to come through, or indeed what the full impact of the policy change on that. So there's actually two elements that were at kind of play there. So there was a national shortfall of the living wage funding that had come through the Scottish Government settlement, and there was negotiations around rectifying that. So that gave us some additional funding there, in addition to a move, as I kind of mentioned earlier, around a kind of national uplift approach to the living wage. So that element kind of cost an extra nearly £300,000 compared to what we had in the budget at the time. However, the totality of the additional funding was over 900,000. So I'm kind of pleased to be reporting that we've got some additional funding for a change through the budget process. So the net position was around 616,000 better off than had been reported back in March. Again, members will recall that we had a savings plan that we agreed to try and kind of bridge the gap, and that was largely a non-recurring savings plan that we put forward. So my recommendation today is to use that additional £600,000 to kind of reduce some of the pressure on a range of services that would be kind of subject to those savings by the £616,000, and that will kind of assist the services over the course of 21-22 as part of our kind of remobilisation, and also just to kind of say ease the strain as demand starts to kind of bounce back to kind of higher kind of pre-pandemic levels as well. So that's my recommendations today, is to kind of make those reductions, given that those level of savings, as I say, were non-recurring. We would have to find kind of recurring savings in 22-23 onwards anyway for those. So just suggesting we kind of reduce. Happy to take questions and see there's a couple of hands.
Yep, I'll take Helen first.
Yes, thank you, Ken. I've said before, our staff really very important to us, and we're only successful due to the work that they actually do. But my question is, the additional funding being used to reduce IJB's required 2021-22 savings programme, and the first step in using the net additional money is to reduce anticipated staff turnover from savings 700k to 350k, which is a half of what the original budget was, a reduction of 350k. To me, this is surely an acceptance that the board's plans left health and social care services in the city understaffed, and I would like to know what plans we have to actually use that money to retain staff and secure the future services.
Right, coming first of all, see Jenny's got her hand up as well. Yeah, I mean, I think when we set the kind of original kind of target, the £700,000, we had made a kind of range of assumptions around when a lot of services would be kind of restarting, and we've taken the experience of what happened in kind of 2021, where we had quite significant underspends in staff because, as I say, services weren't fully opened, and therefore there was a range of kind of vacancies that arose that didn't need to be filled at that point in time. We've kind of looked again. We've as part of this remobilisation, some areas have opened a bit kind of quicker than we'd originally financially planned for. So some, for instance, daycare is going to reopened a bit quicker. So we know there's a lot more of the vacancies are now being filled. And what we're suggesting is that we kind of go back and revisit those assumptions, and just kind of ease that pressure on managers around, the kind of the management of those vacancies as they arise. So in terms of that's why we're kind of looking at that the scale of that again. I don't know, Jen, if you want to come in around some of our recruitment.
I was going to come in kind of more generally, but I will come in around that as well. So I always go back to the original Reshaping Care for Older People report, and one of the things it cautioned was the rate of increase in the need for social care, and how if we keep going at that rate, we'll get to a point where everybody could leave school and we still wouldn't have enough staff. So we've got a kind of double-edged challenge in Dundee, in that the rate of social care has been increasing and the pandemic's left us needing more, and we're trying to keep up with that. But we're also getting to a point where we've increased the level of provision so much that it is more difficult to recruit. So I think there's two things. Firstly, transforming the way we do things and being much more preventative and much more rehabilitative to manage the kind of demand for that. And then the other bit, as Helen and others have alluded to, is the absolute criticality of that workforce and making that an attractive place to work. And I very much see that as the kind of implementation of the findings of the Feely report, looking at fair work and looking at all of these things to do that. But I just wanted to highlight it's definitely a double challenge. We're increasing at a huge rate and it's not sustainable in terms of bringing that workforce in.
Yep, that's exactly what Feely said. And Donald, you no longer want to come in?
Could I come back on that?
Yeah, you certainly can, Helen.
I obviously welcome the report and the additional money, because the services that we're talking about are really life-changing to the people that actually use it. And I believe in our services. And I think the staff who are frontline workers actually have to be congratulated on the fact that for the last year and a half, they've continued with the work because they believe in what they're doing. And okay, some other vulnerable people might need some extra services. And I mean, my view is these people deserve the services. The people that actually voted in our NHS services, they brought the health service, they brought benefits. My goodness, they fought the war, and these are the elderly people who actually really need service. And I actually prefer if they would get more services. Obviously, money is a constraint, but I'm on the older people's side.
Yeah, I hear what you're saying, Helen, but I don't think we should forget the fact that this is extra money, which is very welcome and does significantly reduce the pressure that we face in providing services. So overall, I'm quite upbeat about it.
Yeah, I did welcome it. It's probably not enough.
Yeah, you welcomed it, and then fair enough, highlighted the problems that we still have in providing services in terms of demographics, etc. I was just wanting to. It's good news, because that is very much concluded on that item. There's no other hands up, is there? No.
Yeah, thanks very much, Chair, for that item having been agreed. Item 10 then, before the financial monitoring position, and Dave Berry will be speaking to that item.
Yep.
Thanks for that, Willie. Yeah, so item 10, sorry, I'll wait till I get the right item up on my screen. Financial monitoring position as at the kind of year end. So the reason that we've kind of pulled this report together, this is the second year in a row we've done this is because we obviously present each of the IJB meetings a financial monitoring position, and that's in a kind of particular format that IJB members are used to seeing. And what we're kind of doing here is, now that we've got the year-end position confirmed and the annual accounts are down as the next item, is to almost kind of replicate the reporting that you are kind of quite familiar with, just to kind of, so you can do a comparison with what's been expected before and what the year-end position has delivered. So the net position for our operational position for the year has been a £2.1 million underspend. That's kind of much improved position compared to last financial year when we were sitting with a £4 million overspend. And part of that is, or a large part of that, is actually kind of related to COVID and touches on what I said in response to Bailey Wright's question earlier about some of the staff slippage and turnover, and the fact that we didn't have there was a lot of services weren't kind of fully operational over the year. So that has assisted from a financial perspective the financial position. So the health figure for 2021 ended up with an underspend of £3.5 million. We had kind of previously projected about £2.4 million of an underspend, and most of that movement was largely around additional COVID funding, so expenditure that we were able to kind of count as COVID funding and claim the funding back from Scottish Government, and also an improvement in the prescribing financial position as well. So these were the sort of main areas that kind of took us to a different position there. The council's position, we were overspent by £1.4 million. We had previously projected that we would be about £2.1 million overspent. So that was a reduction of 700,000. That was across not kind of anything in particular other than a kind of whole range of different kind of cost pressures. Didn't necessarily come in as much as we anticipated. So that gives us an operational underspend of £2.1 million. I think the main kind of couple of areas I want to kind of focus on for the board to draw your attention to is around the COVID spend. So on page 41, big page 41, 4.5.9 of the report, you can see we set out, again, it's familiar to members, we set out the kind of expenditure areas from the mobilisation plan, or the COVID additional spend, and we had anticipated we would need about £11.9 million worth of COVID spend. We actually spent 10.3 by the end of the year, and the additional funding from that that we received from Scottish Government, it goes through into our reserves as a committed reserve for 21-22 for COVID spend. The 2.1 million underspend goes into reserves as well. So that was the other significant element I want to kind of pick up with the board. And again, I'd alluded to this at the kind of previous, or certainly the latter reports, around how our reserves position may look. So the bottom of page 41, section 4.6, we started the year with a very, very low level of reserves at 492,000. Because of the spend position over the year, plus the additional funding that Scottish Government released to us kind of late in the year, which included significant COVID funding, so we could pick up any unanticipated spend, but also kind of use that to offset any spend within the current year, plus also the release of some of the funding that was being held on our behalf for things like primary care, Action 15, ADP monies, and also money from NHS side around to support our shifting the balance of care. We've now got a position of have significant reserves of almost £14 million. So £11.7 million of committed reserves, and we have an uncommitted fund now for the first time in a couple of years of £2.1 million. The level of reserves look quite stark, but we're not any different from any other IJB. That's a pattern across the country. This year we've all kind of ended up with significant reserves. And indeed, Scottish Government have actually written in effect a letter of comfort to us all that that they expected the reserves position to be this scale, and they've acknowledged that most of that is committed to particular items. So that is quite a change in the position from what we've had previously. So I see there's a few hands up as well, so I'll stop ranting on and
certainly Donald's hands up. I'm not sure if Helen's hand is just up from the previous point, but I'll take Donald first anyway.
Okay, thank you, Chair, and thank you, Dave. I mean, it's always a really useful report to get and to be able to understand where we are on the finances. I mean, I welcome the fact that we're underspent rather than overspent. You know, clearly question, could we have got a little bit closer to the wire and fully spend? But I'm conscious it's always a difficult process to manage. I'm pleased to see that we've had the opportunity to repair particularly our uncommitted reserves, because as you know, in previous meetings that's been a concern where the tank was almost empty. I had just 2 points. One of them, I'm afraid, is my usual chestnut around the information that we get around old people's services, where I mean, clearly we're both Dundee City Council and NHS Tayside delegated services are overspent. I mean, I can look at the NHS Tayside numbers and I can, you know, maybe offset the psychiatry of old age inpatient versus the, you know, the community. So I can see they net off. I can net off the medicine for the elderly against the prescription overall underspend. But to me, the Dundee City Council delegated services number is a bit of a black box, and we're 1.9 million overspent on that, which is a significant amount. And I really just don't understand how we're getting there, and it prevents us really drilling down in that. So I know I've touched on it before. I'm afraid I'm going to keep touching on it until I get some more visibility around that number. So that was my 1 point. The other one was just a specific query around, it's your paragraph 4.4.3 around care at home services. And it probably harks back to the discussion we had a little earlier on, where what it's saying is there was an overspend there of around 2.5 million, but staff costs have underspent by 400,000. Now, I would have thought, and I may well be wrong, that the biggest cost in care at home services is actually staff costs. So I was wondering if you could maybe give me a bit of context around that number too. So these are my 2 points. Thank you, Chair.
Okay, thanks for that, Donald. I'll start with the second question first, if you don't mind, because I think that actually partly helps to answer the first question around older people's services. So, and apologies because the report should be clearer. So the care at home services that we're kind of describing there with the 2.5 million are those externally purchased ones. So kind of all those that are through the contracts that again we talked on earlier in terms of part of the living wage discussion. So it's what we buy in from care providers was significantly over by £2.5 million, and that's an area that we've kind of looked to kind of try and pull some. We've certainly added some money in terms of budget pressures into the budget this year, but we also know we've got a fair bit of work to do around demand management around that side of things, and be working with Jenny and her team over the rest of this year to kind of look at kind of pulling that back. So the general staff costs kind of element is all other services within Dundee City Council's delegated resources. So that will include things like, you know, again, sorry, go back about the same examples, but day centres weren't open as you know, throughout the full year, and kind of other elements of services. You know, we've not been kind of filling all the vacancies because we've not had to at that particular point in time. In terms of the reporting, absolutely agree. in terms of one figure is not particularly kind of helpful. It's particularly quite a significant figure. That the 1.9 million is mainly made up of the £2.5 million overspend at the external care at home, offset by a number of underspends. But what we're working to for the current financial year is to improve that reporting. So we've kept it similar because that's we've done it across 2021, and it's been the final 2021 report. We kept it at the same level, while we still can undertake the work to kind of split that further into something that's more meaningful. So what you'll see from our August report will be a much more detailed kind of level of expenditure, and probably to the point where we'll have, if you take older people services, for example, you'll have what's the care at home stuff that we purchase, what's the care home spend that we purchase, and our own residential care, and working her through that. We're not wanting to kind of completely flood you with information, but it's about getting that right balance, so you've got sufficient to be able to do the offsets or kind of work things through. So hopefully that answers your questions, Donald.
Yeah, no, thank you, Dave. That's helpful, and I look forward to seeing the expanded report.
Thank you.
Helen, you're next.
Yeah, I agree with Donald. It's one of the services that I, in particular, as everybody knows, I'm quite interested in. My question's on page 38, 4.3, and it's the huge amount underspent in NHS Tayside delegated services. And I'm just wondering, how certain are we that this simply isn't being caused by people not seeking help or medical assistance during the pandemic? And just wondering, it may not be easy, but what work has been done to study this, and also to encourage people to continue seeking medical advice where appropriate? Thank you.
Okay, thanks for that. So in terms of that, yeah, the underspent £3.5 million, as you can see there, quite a significant part of that was the prescribing budget. And we do know that, and again, it's across the country, it's not just the Dundee position, that because of well, there was an initial spike probably about the tail end of 2019-20, so just when the pandemic started, prescribing kind of figures for about a couple of months kind of shot through the roof, because people were stocking up on their kind of, prescriptions. That then started to dip over the start of the pandemic, and with GP practices being kind of relatively closed for some time, and then they've still got, well, they're still open in terms of being able to kind of deal with urgent issues. We are finding that there's not the kind of the significant bounce back of prescriptions yet than we've had in kind of pre-pandemic. So that's kind of a significant element of that. The same issue I talked about in terms of council services, some of them not being fully opened, that applied to some health services as well. And given that a lot of the kind of health staff were kind of redirected to things like testing programme, vaccination programme, etc., they were kind of in effect being funded from other sources over kind of large parts of the last financial year. So they certainly COVID has certainly had a significant impact on the expenditure pattern over the course of 2021. I see Jenny's got her hand up as well. Don't know if Jenny wants to.
I think she's wanting to come in.
I think it was more about the bit about people seeking treatment when they need it. It's very much a live issue, Bailey, right? And I think there's quite regular things go out through the comms team in NHS in particular, encouraging people to seek treatment where they need it. What we are experiencing at the moment, sort of reassuringly, even if it's a bit pressured, is quite an increase in demand for things like primary care services and other kind of planned services within the NHS. So it would appear at least that people are now seeking treatment, and we're experiencing that as a high level of demand.
Well, that's good to know. Could I ask Dave, about the prescribing budget, because I think they've probably got to be congratulated for the saving that they've made on that. But I was just wondering, was it through negotiations with the companies that they get the drugs from, or is it by using cheaper medication that might not be quite as effective as the well-known brand?
So in terms of the prescribing management group, so that's kind of Tayside wide, that kind of oversees a lot of the kind of the initiatives. If you recall, we've kind of brought down the prescribing spend within Tayside, and with Dundee in particular, we're now kind of well under the Scottish average in terms of the number of items and the cost per item. So a lot of that has been down to kind of different initiatives that have been put in place. So, you know, things to design to kind of get rid of waste within the system. But there's also kind of change. No, absolutely. There's been a number of changes in terms of the types of the certain drugs that have been used from branded to non-branded, but they're all been kind of on the basis that in effect it's the same product. It's the branding that you've been paying for, so they're all kind of safe. There's no sort of medical. If there was any sort of medical issues around those, they would not be kind of switched to. That's kind of, it's a panel of experts that look at that. In terms of the pricing, pricing for prescribing across the country is actually managed at a national level. So again, we would kind of react to what's on formulary within Scotland and how that's kind of applied locally. But a lot of the drive has been, as I say, about a more effective prescribing kind of processes that have been put in place without kind of risk to any sort of patient safety.
I'm really pleased to hear that, Dave. I'm glad you mentioned that. But while we're on the subject of the waste, I was just wondering, I know that there was plans at one point in time, you know, the bubble containers that have the medication in it, and the waste of one medication has changed, everything in that bubble pack has been wasted. Has anything been done to alleviate that?
I couldn't comment personally on that one. I can certainly kind of find out around that. I don't think there's anybody on the call today that would know that particular detail, but we'll certainly kind of get back to you on that, Bailey, right? Okay, thanks very much.
Yeah, that point you made about the cost and switching to different drugs. It's like buy Panadol. Well, Panadol probably cost you £2.50, but if you buy like the branded one in Tesco, it'll be 28p. So yeah, that's one of the ways that they've done it. I think rather than giving them inferior types of medication. I'm usually quite good at keeping track. It's because of this iPad. I think Trudy's next. No, Raymond. Sorry, Raymond, then Trudy.
Thanks, Chair. Mine was probably similar to right. I suppose want to be a wee bit more specific though, because I'm concerned. I mean, even if we look at some of these savings pre-COVID, there's still the same kind of savings, particularly in the areas of learning disabilities, which is a bit of a concern. And also then you look at the figures, and obviously significant savings within psychology services, sexual health, and if I'm reading it right, POA as well. So I'm really concerned about these areas where you would think there would be, I appreciate the COVID situation, but these services you think would still be running. But if I was to go back to previous financial reports for previous years, the one that sticks out for me and is a real concern is learning disabilities. That appears to be year-on-year savings. So I'm really concerned about that. I suppose I was looking for some assurances that likes the questions that have been asked around ensuring that people are getting the services that they need to receive. Thanks, Chair.
Someone like to come back on that point about savings and learning disabilities in particular?
Yeah, I'll comment. It's more sort of general point around a lot of the sort of vacancies. I don't know if Diane's got more information, but a lot of the vacancies arise not because managers are trying to kind of manage kind of savings or anything like that. It's more about availability of staff and recruitment issues. We certainly know around psychology for years that's been part of the issues. Is not being able to recruit or kind of retain significant amounts of staff there. And I don't know if specifically, I don't know if Diane has that, but you know, whether learning disability falls in that category or not. Diane, do you want to come in?
Yeah, I can confirm, Raymond. I'm happy to kind of provide a more detailed kind of information to you out with the meeting in terms of learning disabilities, but it generally links back to the recruitment, particularly of medical staff across things like mental health, learning disability, but also specialist staff. The psychology one, I can confirm that we're doing some particular work around in terms of the budget, looking at that in regards to the different specialities, the areas of work and the modelling of the service that goes along with that. And they do have difficulties recruiting because they tend to recruit at the point at which staff are coming out, so they can carry vacancies for a few months waiting on the new students coming out of university, that kind of work. So my sense would be it's generally around recruitment, but I'm happy to come back to you with something more detailed around the learning disability if you're particularly concerned about that.
Thanks for that, Diane. Trudy, please.
Yeah, I just wanted to go back to prescribing, and I'm making a plea that there perhaps could be a wee bit more focus on social prescribing and working with primary care to promote social prescribing, because going to your GP, for example, with some kind of distress mental health problem, it may be more useful, rather than being given a drug, to being directed to a support service or a peer service, like the Men's Shed, for example, has helped many people without having to have additional drugs. So I'm just making a plea that perhaps more focus on social prescribing to support our population in many areas.
I think there already is a strong focus on that, and needed more than ever now, when more people will be presenting with mental health issues that could probably be better resolved by a social solution rather than one that's medicated.
Chair, I'm happy to say something on that, if that's okay, before you move on. I absolutely kind of support what Trudy said. I believe at a previous meeting we did come back with some information around social prescribing. I think that is picking up again, Trudy. Obviously, there have been issues around social distancing around some of those services, and certainly from Dave's service, there's a big focus on ensuring and working towards getting the staff who support that piece of work back into GP practices and making those connections. So that is and continues to be a focus for the services.
Thank you, Diane. Very assured.
I don't think I've missed anyone. So yeah, again, another interesting conversation around that paper, which is for noting. So can we move on, please? I think we're getting to the end almost, aren't we?
Yeah, thanks very much, Chair. Item 11 now is the unaudited annual accounts. Dave Berry will speak to that item.
Okay, thanks, Willie. Yes.
Can I just say, if anyone would like a break for a minute or two, because we've been in here for 2 hours. I realise, and if anyone wants a break, I'd be happy to agree to that. Or would you want to move on? Yeah, let's have 5 minutes. 11:57. We'll see you at 12:03. Okay, thank you. Willie, is Willie back?
Yeah.
Yeah, thanks very much, Chair. Yes, item 11, just where we left off. So, audited annual accounts, and Dave Berry will be speaking to that item. And just to confirm, the interval will be removed from the recording. Yeah.
Yeah. Okay. Thanks. Yeah, it wasn't part of the formal meeting. I like to remember that in future.
Okay, thanks, Willie. Thanks, Chair. Yeah, so the kind of final paper today is the unaudited annual accounts. As you'll see, that's kind of largely a kind of technical document, and as part of our kind of statutory requirements to submit. Now, we're still sticking to submitting by the end of June because of the kind of COVID implications. We could be granted a 2-month extension should we wish it, but my view is that we've done all the work on this now, so submit it for to audit to commence that as soon as they can. You'll see at 4.1.2 that the audited accounts themselves will be presented to the Performance and Audit Committee at the meeting at the end of November. So that gives Audit Scotland quite some time to kind of carry out their audit and kind of pick up on any issues, and we can clarify as well over that period. So the paper itself consists of a kind of funding variations, so the differences between the budget that was agreed and then the budget that we end up at the end of the year, because throughout the year there's quite a significant amount of movement of resources, usually around additional resources that come through either from Scottish Government or kind of agreements that have been made kind of locally about particular funding of posts or whatever. So and COVID obviously comes into that this year as well. We've also got our annual corporate governance statement that's kind of embedded within the accounts, but we've kind of pulled that as Appendix 2 as well. That's a requirement within the accounts process itself, and that kind of largely builds on a lot of the things that Tony had talked about this morning in terms of the work that audit do. Self-assessment, kind of we've got a number of self-assessment questionnaires that we work through to provide assurance around our sort of governance procedures that are in place and arrangements, as well as kind of pulling through some of the actions from the governance action plan that again members of the Performance and Audit Committee are kind of very familiar with within there. You'll see in terms of the financial implications that, you know, the way that the accounts are presented, they go straight to showing a £13.3 million surplus, because it takes in all the money that then drops into reserves. So I think that's why it was kind of doubly important. We kind of had the previous report which showed the kind of the true operational position and then the impact of kind of reserves on that. So anybody kind of looking at the accounts will think, we'll see that we've made a £13.3 million surplus, but that's the story behind that is more around the fact we've had that additional funding in place. So I'll probably kind of leave it there again, because I see there's a number of hands on up on this item. So
yeah,
I'm not sure. I'll let you decide who's first.
Well, it's definitely Annie. I've got it right.
Thank you, Chair. I just wanted to say, Dave, I think the report with all the graphics is really accessible and very readable, so congratulations. This is probably nothing to do with the accounts per se, and maybe, but I don't know if anybody will be able to help today, but some of the stats I knew about because I'm Dundonian and I did a lot of reading ahead of my interview, but the one that stands out is that we've got the highest proportion of adults with a learning disability in Scotland. Now, I don't know why. I don't know if at some point somebody might be able to give me some of that information, because it's not something I was ever aware of. So that was all. Just congratulations on it being accessible, and I would like at some point, if he has a bit more information about that, that would be interesting, please. Thank you, Chair.
Trudy, please.
I'll come in on Annie's last point and say that when I first joined the IJB, I asked the same question about the learning disability, and I was told that people move into the area because the support and the care for people with learning disability is better in Dundee than in many areas in Scotland. So people do actually move into this area just to get that support. And I'm sure that's probably the same case. Going to page 61 of your paper, and it's the 9th para down, and you just all know I'm going to talk about the registered medical practitioner again. We still don't have one, but we're hoping that we do get one appointed for July, someone who's coming to the Lockheed practice who said that he would be keen to join the board. But my point today is not particularly about that, but about the fact that we are an integrated joint board for health and social care. and we don't have any medical input at all, nor any public health input. Now, I understand that there is a COVID surge, and probably the medics are probably very embedded in working in the COVID surge. But as an IJB, we do need medical input. Thankfully, we have Wendy Reid, who's nursing, who's on the call, should we have had any real questions. But if we'd had any real medical type queries, how would we cope with that?
Yeah, you're right. I mean, I know that Drew Walker used to come along quite frequently.
Yes, he did.
We haven't seen much of Emma Fletcher, but I mean, she has had a lot to deal with in terms of a public health emergency. So,
yeah, I do understand that, but I feel that perhaps maybe someone delegated to her, to her role would be useful, and I wonder whether we should contact them and say, can you appoint somebody to come in your place?
Yeah, I think that would be down to me then, to contact Emma Fletcher and recognise the difficulties that she personally faces, but ask that we have someone delegated, because it is only 2 to 3 hours every 2 months, and it's important to have that input, as you say. Donald?
Thank you, Chair. I mean, I agree with the last point as well. I mean, clearly, you know, the public health team have been balancing a great many priorities over the last few months and have worked incredibly hard. And I don't think we would want to disparage that at all. But as we move out beyond the second wave or the third wave or wherever we are, you know, public health is going to be absolutely key to what we do in the community. So it would be really invaluable to get that sort of input as we go forward, and indeed the medical input, as Trudy says. So supportive of all of that. My other comment was just going to be a very brief one. I think, you know, well done to Dave and his team for getting the accounts out. And I think in particular, getting them out to the normal schedule rather than taking that additional 2 months. You know, it maybe seems like a good idea to take the extra time to do it, but all it means is all the other things that are in your inbox get pushed back for a couple of months. So, you know, once the accounts are out of the way, you can move on to other perhaps more interesting things. So no, well done. And I think the other point, we will need to be very careful with our messaging around the reserves and why why that number of 13 million appears, and that it's not simply that we have, you know, underspent by 13 million. So I think there's a really important job around the messaging there.
Helen?
Yeah, I you have to excuse me, I've had to put my earphones on because they're digging up the road right next to the window here. There's work's going on. It's got worse. Yeah, I would agree with Trudy in what she's saying. And in fact, people, if they're supposed to come, they should be. If they're on the committee, they should be here. But as far as would somebody further down the ladder be able to take action? Because normally, if we're looking for somebody who's actually speaking, that's got the ability to take a decision on something. So hopefully it would be somebody that's coming along that's actually able to do that.
Absolutely. Can that be minuted, Willie, that I've agreed to take that forward?
Yeah, thanks for that, Chair. Yeah,
account for it. I'm sure you have minuted it anyway, but Lynn, Councillor Short.
From the point of view of being new onto the board, I think this is a really useful document because it's very much takes you back to the very basics, and I find it really probably why I'm asking less questions today, perhaps, to have that actually in front of us. It's really good to have, and so that was 2 months extra that you saved by bringing it forward now. So it's very clear, and I did have a wee query, but it was more to do with around the life expectancy, and I'm presuming the life expectancy graphic only talked about the medical things as opposed to sort of the wider life expectancy reasons, because I'm working on the premise that there's more than just the health implications of life expectancy. But otherwise, thank you for bringing this forward. Appreciate it.
Helen, would you like to come back in? No.
Sorry, it's a legacy hand.
Dave?
Yeah, thanks, and thanks for the positive feedback on the report. I'll certainly kind of pass that back to the team that have kind of pulled this together. So so thanks for that. In terms of the life expectancy, I mean, I suppose there's different ways you can kind of show things, kind of, Lynn. I mean, I think we're trying to keep as much of the infographics as simple and kind of easy to understand. So it is a kind of a straightforward sort of measure that's been kind of we've taken out there. If we look at some of these, a lot of statistics or the sources, there's lots of different ways you could kind of present things. So try to get that again back to balance with something that's informative but not too complex for people, for the kind of user to understand. But again, if there's any kind of comments on that for future, we'll be happy to take that into consideration. I actually meant to kind of mention, and this is so we can kind of formally minute, I had a kind of briefing with Martin and Linda before the meeting, and Martin had pointed out that a wee change to be made is on page 71, because it's noted as Martin Sloan under the membership, that he's a carer, Dundee Carer Centre, and just to acknowledge that he's not actually, although Dundee Carer Centre support him, he's not a member of Dundee Carer Centre. So I'll make that adjustment to the final version. But Willie, if you could please just note that as an amendment for that. Thank you.
Yep. Trudy?
Going back to Lynn's life expectancy question, and when you look at the life expectancy, it talks about health problems, smoking and obesity, all are public health things. It just reinforces my concern about no public health presence on the board.
Completely. And when I think about it, you know, when the board of NHS side, there's a representative from everyone there. We've got our chief officer sitting there all day for maybe a 10-minute input, and we've certainly got public health there. So it's no less important that we have that representation on the IJB. Mm-hmm. So I will certainly take that forward, because I'm hearing you loud and clear on that. And I've got a hand just been. Linda, would you like to come in?
Hi there. Just as a point of interest, I, for the last 2 meetings, have been invited to attend the dental executive group meetings, which at probably another aspect of our citizens' health, which doesn't always come to the forefront. They've got a lot of information about the population, from children's dental health right through to the elderly, and how difficult it is to get back into the care homes just now. So, you know, if it was appropriate and if it was okay with the dental executive group, maybe I could feed back from time to time into this meeting.
Absolutely.
You know, they do really good things like the mobile dental unit. They've got quite a lot of information about homelessness and that happening, because I think they're based at the Steeple Church when they come in. So I would think they would have a really good overview of quite a wide demographic. So if that worked, I could certainly ask if it was okay to feed back.
Certainly works for me. Yep. I don't think anyone will disagree. So yeah, thanks for that, Linda. And Trudy?
Yeah, just when you mentioned the word dental, Linda, it struck me that we need to actually recognise the input the dental teams have made to our COVID pandemic management, and they've all come out of their dental practices in many ways to help out, either as vaccinators or as people who manage the process of people coming for test and protect and everything. So the dental teams have been hugely involved in COVID, and just as an IJB, Ken, I wondered if we we just say thank you in our minute to them.
Yes. Yep, that can be minuted. Yep. I don't think there's any other hands. Oh, there is. Yeah, Anne. Sorry.
Chair, before we finish, could I just ask if Willie Waddle would put his camera on so I could say hello to him?
Go for it, Willie.
Yeah, maybe your last meeting after you see me. Yeah.
Okay. Nice to meet you now that we've been
Hello there.
emailing each other.
Nice to
Thank
see you, Anne.
Thanks.
Thanks very much.
And yeah, so I think we've kind of agreed to the recommendations here, which is that they'll be submitted by the 30th of June. So thanks for that.
Okay, yeah, thanks very much. Your item 12 has been dealt with. Item 13 is just the adjustment to the standing orders. I'm just asked to agree to the terms of the note. Sure. Then have item 14. With that item having been approved, item 14 is meetings integration joint board attendance. That's simply for noting.
Yep.
Item 15 is the date of the next meeting, which is Wednesday, 25th of August at 10 AM.
Yep.
And that's noted.
And Donald?
I was just related to that date of next meeting point, was just going to ask Willie where we are on the risk development session, because I know that was intended to be by the end of June, but I think diaries have been a little bit challenging. So I was hoping we'd be able to reschedule that though.
Dave's hands up here, maybe he's got something.
Yeah, thanks for that. Yeah, Donald. Yeah, we did try and get something organised in June, but as you say, diaries were a bit quite difficult to do. So, what I've suggested is that we try and get some time organised quite soon, but for August, after the kind of council recess, etc. So, and that'll also give us a bit of time to perhaps work with other IJBs. Perth and Kinross are looking to do something similar with their IJB. I think it's actually the same day as we've got our IJB meeting, but we did talk about sharing resources as part of that work. So it'll give us time to maybe do a wee bit more of a focus session on that. And Tony's had also agreed to kind of help us out with that too. So I need to be, make sure Tony's available to present. But it's not disappeared. We're just trying to get something to suit.
Okay, thanks, Dave.
Well, that concludes our meeting, I hope.